Hey everybody, it's Dr. Joe from Chiro Health Spa here, and today we're going to talk about what we do for lumbar or lower back disc problems. If your lower back pain is coming from a disc issue, we want to talk about that and what we actually do today. So before we start, we want to talk about first what a normal set of bones looks like. So you have two bones and you have a disc here and a nerve that's coming out of that, and that's a very sensitive nerve. Now that disc should not be laying on that nerve right there. It shouldn't be laying on the nerve. When you have something like a bulging disc or a herniated disc, what happens then is that it's actually putting more pressure on that nerve, because you can think of a disc like a jelly donut. If the jelly squeezes out, a herniation starts pushing on that nerve, and wherever this nerve goes, you're going to then have potentially pain, numbness, tingling. So this is now our telltale sign that we're going to start using a different therapy to be able to address what that disc is doing to this nerve. So what you're looking at is something called spinal decompression here, okay? So what we have here is Una, and she is just laying on this table, and all this is going to do is, if you think about what this nerve is, the kind of pressure that it's getting from this disc, what we're doing with that is, while she's laying on her back, this is going to start opening those bones up, and it's going to open them up and close them, and open and close and open and close. And you can see right away, just by me doing this, that you've taken pressure off of that nerve, because now there's breathing room for those discs. So we use this decompression, this spinal decompression, to literally open the spine and take the pressure off of those nerves. Now, in the first time or the second time, usually people say, wow, I feel a lot better. I actually feel even a little bit taller, and I feel like I just got stretched out. And that's exactly what this is doing. So while she's laying here, what's really happening is that there's a motor over here, and it's pulling and opening this space here. So when it's opening here, this belt here is holding her in, and the table is literally just opening that space. And when that's doing that, the pressure starts relieving. A lot of people with back pain from disc problems say immediately, wow, that felt better. Now, it doesn't last very long in the first one, so that's why we have to do it multiple times, so that your body starts remembering the muscle patterns and how we want those bones to stay in a position so that that space is opened up. But when we see somebody that comes in with an MRI, for example, or we look at x-rays as well, to try to determine, listen, where is that disc getting the pressure? When the disc is getting the pressure onto that nerve, then that tells us right away that we're going to use something a little bit differently to try to address that specific area. And we find that with an MRI many times, and you may have an MRI that you've already said, well, I already know I have a disc issue. Well, when you come to us, you're going to bring the results of that MRI, and we're going to determine if you're a candidate for spinal decompression, because we know full well that if things fall right for your condition, this really could change your life. There's no question about it. So if you know anybody that has any kind of disc issues, or if you have them yourself, please share this video, and we'll see you on the next one. All right, thanks a lot.